Good afternoon. Today we are talking about SIBO and bloating. So a lot of people know what SIBO is. A lot of people hear the term tossed around, and a lot of people think they have it, but they're not sure. So we're going to talk about all of those things, what it is, how to test for it, how to get to the root cause, what to do, all of those good things. So let's just dive in. So what is SIBO? It's S-I-B-O, and SIBO is small intestine bacterial overgrowth. Now, here's how our digestive system works, kind of in a quick way. We eat food, goes down into our stomach has a really high acidity, and that acidity allows the food to break down. It also kills bacteria, viruses, pathogens, things that we don't want. Now, once that food is broken down, it goes into the small intestines where it meets all the enzymes from the small intestines, bile from the gallbladder, enzymes and insulin from the pancreas, and all of the long winding roads of our small intestines where food gets broken down, digested, and absorbed. Now, because of that super high acidity from our stomach, our small intestines actually don't have a lot of bacteria in them. So when we take probiotics, we're actually taking them for our large intestines. That's where all the good bacteria, I don't like to say bad bacteria, but opportunistic bacteria lives as well. So actually our small intestines don't have as much bacteria. So when you see your probiotic says enteric coated or all these fancy words, what that means is it's going to be able to bypass your small intestine and stomach, not get completely dissolved and eaten away with all the acid, make it to your large intestine so that way it can populate and have all that good flora. So sometimes what can happen is there is a flux of bacteria from the large intestines into the small intestines. And this can happen for a number of reasons. Sometimes it's trauma, like physical trauma directly to the gut. Sometimes it's a neurological issue where the vagus nerve just doesn't tell the small intestines to move. The valve that links between the small intestine and the large intestines, that IC valve, the ileocecal valve, sometimes gets confused. Sometimes it stays open and all that bacteria rushes up. And whatever reason, it happens. It actually happens after a lot of TBIs as well, traumatic brain injuries, concussions, car accidents, hits to the head. So if you were in a car accident, and I see this all the time, this is why I ask everybody about concussions, and they're like, oh man, 6 months later I started having all these symptoms, especially in my gut, I'm gassy and I'm bloated. I'm like, SIBO, vagus nerve. So what happens is our digestive system starts to shut down. We don't make as much stomach acid, so you might have more reflux, you're burping, you're having that heartburn, you're not digesting your food as well. You start having maybe right-sided liver pain, even left-sided pain can mean you just don't have enough pancreatic enzymes. You start to get bloated. Now here's the problem with SIBO, is that it causes all of the symptoms, and not every SIBO patient looks the same. Some might just have acid reflux and they're like, oh my gosh, my heartburn is so bad, I don't know what to do. Others just have bloating and gas. Others have constipation. Others have diarrhea. Others have all of the above. So sometimes it can be really hard to diagnose yourself just based off of symptoms alone on if you have SIBO or not. So the other, well, we'll get to that. Okay, so that's what SIBO is. There's all those bacteria start to populate your small intestines where they shouldn't be. There's not enough acid to get rid of them. There's issues between that ileocecal valve where bacteria is still coming up. There's lots of things going on. So how do we test for SIBO? Now, if we want to do an actual test, you do a breath test. So you drink a sugary solution and then you breathe into a tube, multiple tubes over a 3-hour period. Now you want a 3-hour test and you want to test for 3 different gases. You want to test for hydrogen, you want to test for methane, and you want to test for hydrogen sulfide as well. A lot of SIBO tests will just test for just methane or just hydrogen, and a lot of GIs will be like, oh, guess what, you don't have SIBO, but you're still having all the symptoms. So you want to make sure that the test that you do, and I'll drop a link for a test that's available online that you can order yourself, or you can order through me and do it at home. is really, really easy to do. And so what happens is as you drink this sugary solution and you're breathing into the tube because you're producing these 3 different gases from your small intestines, it shouldn't really have a spike, right? It should just go, you had a little bit because there's a little bit of bacteria, and then it goes down. So some people with SIBO is like, oh my gosh, we're producing so much methane or hydrogen sulfide, and that's what's causing all these symptoms. Why you're so gassy and bloated. Maybe you might even be vomiting, IBS, all of those things. So that's the test. Super easy to do. You can do it at your GI office, or you can order it home, send it in, and have the results there as well. A lot of functional labs offer them as well. So lots of different options there as well. The other way to kind of test at home without spending money is to do what they call the low FODMAP diet. So that means low fructooligosaccharide diet. So the FODMAPs are what are in the foods that trigger the bacteria to have a party. They love these types of sugars. So it's not a sugar like a Dr. Pepper sugar. It's a natural sugar. They're in garlic and onions are the most common foods that these things are found in. So if you eat garlic and onions and you're like, oh my gosh, I feel so sick, then that's probably a sign you have SIBO. And then you take them out and you go, oh, I feel so much better. That's probably SIBO, and you could probably just go ahead with treatment if you want to skip the testing. What I will say is that most SIBO people are different. Now, of course, it depends on what type of bacteria you have and what gas they are producing, whether it's methane or hydrogen. Whereas some SIBO patients can tolerate certain high FODMAP foods and they're like, oh, that doesn't bother me at all. But oh man, this type of food really bothers me. So I'll put a link in here that has the SIBO guide in it so you can look at it and start to reduce those high FODMAP foods in your diet, see if that helps support your digestion. Now, of course, we want to get to the root cause. We don't want to sit here and be like, oh, I just will totally destroy my diet and never eat anything fun again and life will suck. That's not great, right? So the #1 treatment, of course, for SIBO is antibiotic, prescription antibiotic that you can go to your GI and get. It's very gentle, it's very easy on the stomach for most people and very effective. However, the relapse rate is the issue. So the second thing that we can do while you're doing that treatment or you're doing herbal support for that is to do brain exercises. So #1 reason that SIBO continues to relapse is that the motility of the small intestines is not working. So when you think about a baby and they have colic, what is colic? Colic happens because the brain is not necessarily connected to the stomach and the intestines the way it's supposed to be. So our gut should move, it's called peristalsis, in one direction, right? Say it's going this way, like, all right, we're going this way. Well, sometimes the babies are like, well, I don't know where I'm supposed to go, so it goes the other way, and then we have all this cramping and pain. So with SIBO, sometimes it's slowed down, that peristalsis, that movement. It's like, oh my gosh, that's the constipation, right? Sometimes it's too fast, and that's the diarrhea. So what we really want to do is get the vagus and the brain online. So we want to do exercises that support that. So some physicians will recommend motility prescription support like Motegrity, which can really help increase the movement of the small intestines to get food through, so the food doesn't have time to sit there and back up and create all these gases and pain and bloat and all of the other symptoms that you have. And the way to work on the vagus nerve, which talks to the small intestines to tell them to move, is gargling and gagging. So taking your toothbrush, pressing down the back of your tongue, eliciting a gag. You don't have to strep test yourself or anything like that, but enough to make your eyes water will activate the vagus. Now you need to do this about 3 times a day. Some docs might tell you more, some might just say once a day. I like to tell my patients at least start with twice a day, morning and night when you're brushing your teeth. That will help speed up this process. Gargling with water is the same rule, but you have to gargle pretty aggressively to get your eyes to water. So I suggest gagging. It's really easy to do. No, it's not sexy or fun. There's also other exercises where they're called the salamander exercises, and that also helps activate that vagus. They're very easy and gentle to do. I think what I'll do is I will link my Balancing the Brain course. It's a free Facebook group on here with all of the videos, all of the suggestions that I give to everybody to help support this brain health, because brain health is digestive health. Okay. And then the other things that we want to do, so we covered eating low FODMAP, at least for a while. We covered whether you get prescription or herbal support to help reduce the bacteria in your gut. We want to help the small intestines move. The other thing, and depending on you, your blood sugar levels, your adrenals, and how you're handling it, I do like my SIBO patients to eat more staggered. So instead of eating small meals throughout the day, to eat every 4 hours, so that way you give enough time for everything to move through. You definitely want to make sure that you are taking digestive enzymes. However, you do need to be very, 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 very careful with probiotics, because if they open up in your small intestine and you're just feeding more bacteria into your small intestine, which is doing the opposite of what you need, right? So you can take, Apex has a great probiotic called Sybiotica, which is specifically made for people who deal with SIBO but still need large intestine health. So I'll post a link for that here as well. But I would naturally avoid probiotics for a while you're going through this support phase, and as well prebiotics. So you notice that a lot of supplements have prebiotics in them, beta glucan. Those can fire up, of course, because prebiotics, fermented foods, will feed the bacteria in your entire body in a good way, but with SIBO it's going to make you more bloated. So you might avoid those foods while you're going through this transition, so that way you can go back to eating your favorite foods. So if you're feeling bloated and you just can't get to the answer and nothing's working, SIBO might be one of those underlying causes. Like I said, I'll drop the links for everything down here below, a great testing site as well. Talk to your doctor, your GI, or make an appointment with me so we can help you get started feeling better, less bloated, better digestion, and better energy. All right, thanks for tuning in, and we'll see you next time.